When people think of mental health, they often picture therapy sessions, hospital wards, and personal struggles. But behind the scenes, mental health has another dimension that can impact the economy just as other factories and industries do. Poor mental health drains productivity, increases healthcare costs, and destabilizes communities. On the other hand, strong mental health systems can boost economic output, reduce unemployment, and protect family incomes. Globally, the World Health Organization estimates that every $1 invested in scaled-up treatment for common mental disorders yields a $4 return in better health and ability to work. In other words, investing in mental health is an economic opportunity. In Nigeria, that opportunity is immense. Mental illness affects millions, yet services are chronically underfunded and understaffed. The passage of the National Mental Health Act in 2021, the first major mental health legislation in nearly 70 years, offers a blueprint to change that. Understanding this law through an economic lens helps us see its potential to improve lives and grow the economy. Let's break this down. Nigeria's previous mental health legislation, the Lunacy Act of 1958, was outdated, stigmatizing, and silent on many modern rights and funding issues. For decades, reform attempts stalled. Bills introduced in 2003 and 2013 failed to pass, often due to political inattention and the stigma surrounding mental illnesses. Persistent advocacy from mental health professionals, civil society, and international partners finally bore fruit with the Mental Health Bill of 2021. The National Assembly passed it in November 2022, and former President Muhammadu Buhari signed it into law in January 2023. It replaced colonial-era provisions with a rights-based, service-oriented approach. For the first time, Nigeria had a law that set out a framework for funding, service delivery, and integration of mental health matters into public policy. The case of investing in mental health is clear. Globally, mental disorders are estimated to cost the economy about $5 trillion per year in lost productivity, healthcare costs, and social burdens. In sub-Saharan Africa, they may account for up to 4% of GDP losses. In Nigeria, the exact figures are scarce, partly because mental health isn't tracked well, but indirect signs are everywhere. Workplace absenteeism, high unemployment among people with mental health conditions, and family members forced to leave work to care for their loved ones. Nigeria's overall health budget is already tight, hovering under the 15% target set by the Abuja Declaration, and mental health historically receives a negligible share. This underinvestment means preventable conditions worsen and increase treatment costs later, deepening poverty. The National Mental Health Act provides mechanisms to reverse this trend, but those mechanisms must be funded and implemented. The Act contains several parts that directly tie into economic realities. One is the Mental Health Fund, which is meant to gather money from government budgets, donors, and private partners. If well managed, this could ensure steady funding for new facilities, training mental health workers, and running community programs. Without this dedicated fund, mental health will keep losing out to other urgent health needs. The Act also creates a Department of Mental Health Services to coordinate national policies and plans. Good coordination can save money by avoiding wastage and can make purchasing medicines and equipment cheaper when done in bulk. It also protects employment rights, which is important because losing jobs due to mental health issues is a hidden drain on the economy. When people are protected from discrimination or unfair dismissal, they stay in the workforce, pay taxes, and are less likely to need welfare. Support for carers is another key part. Many Nigerians looking after relatives with mental illness have to reduce work hours or quit altogether, which means less household income. By offering help like respite care, allowances, and training, carers can keep working and earning. The push for community-based care also has economic benefits. Hospital treatment is costly, while community services, if done well, are cheaper and allow people to keep their jobs, education, and family connections, lowering both direct and indirect costs. Lastly, the Act protects the property and affairs of people with mental health conditions. This stops exploitation and prevents families from slipping into financial hardship because of a relative's illness. But economics can sometimes feel abstract until you see it in everyday life. Imagine two scenarios. One without the Act. A factory worker develops depression. Without legal protection, he is dismissed. His family loses income, he can't afford care, and his condition worsens, perhaps leading to hospitalization. The factory loses an experienced worker, recruitment costs rise, and unemployment and poverty rates go up. In scenario 2, that same worker receives protection from dismissal, gets referred to community-based services funded by the Mental Health Fund, recovers, and returns to work. His family's income remains intact, his skills stay in the economy, and hospital resources are freed up for more acute cases. Multiply that across thousands of cases, and the economic difference is enormous. The WHO has shown that even small investments can produce large returns. If Nigeria spent just $1 per person annually on mental health, roughly 1,500 naira, the long-term benefits could be worth 4 times as much in increased productivity and reduced healthcare costs. That's an investment of under 350 million naira for a potential 1.4 billion naira return, before even counting the social and human benefits. Now, the Act's passage was only the first stop. Without proper implementation, the law risks becoming symbolic and, like many others, a well-written document without economic or social impact. Mental health is both a moral imperative and an economic strategy. The National Mental Health Act of 2021 gives Nigeria a legislative framework that recognizes this. It connects rights, services, and funding in ways that could improve lives while boosting productivity. The next challenge is ensuring it's not left on the shelf. Over the past few years, the implementation gap has widened. If done better, the Act could turn mental health from a hidden economic drain into a contributor to national growth.